Hello, and welcome to Pediatric Doctor at Home, a channel dedicated to sharing concise and practical health related tips with parents and caregivers of children and young adults. Today's discussion is about nosebleeds, also known as epistaxis. Nosebleeds are common in children and can be frightening for parents and the children themselves. However, nosebleeds are often not severe and can be easily managed at home. The nose has a rich blood supply, and there is a concentration of tiny blood vessels on the wall that separates the inside of the nose into a right and a left side. This area of the nose is where the majority of bleeding occurs in children. Also, the lining of the nose is thin, so the blood vessels easily get broken and bleed. What are the causes of nosebleeds in children? Trauma to the nose, which could be from things like nose picking, a pretty common habit in childhood. Trauma could be from injuries from sports, falls or altercations, or even foreign objects that children sometimes put in their noses. Nosebleeds also occur when the inner surface of the nose is irritated, usually from exposure to dry air, especially during the winter season when indoor heaters are used. Nose congestion from common colds or allergies, as well as chronic use of nasal sprays, may also irritate the nose. Inhaling substances of abuse like cocaine and chemical vapors cause nose irritation as well. Other causes of nosebleeds include nose tumors, certain medications like aspirin, or medical conditions that predispose a child to spontaneous bleeding. Sometimes no definite cause for a nosebleed is found. What can you do for nosebleeds at home? Try to stay calm. If the child is distressed, provide reassurance or use distraction tactics. Keep the child seated up and leaning slightly forward. Do not tilt the head backwards because blood may accidentally get into the lungs or, if swallowed, can irritate the stomach and induce vomiting. Pinch the nostrils together for 5 to 10 minutes while the child breathes through the mouth. Applying pressure is the most important thing you can do to try to stop the bleeding. Even if the bleeding is on only one side of the nose, you should pinch both nostrils together. Make sure to hold the soft part of the nose tightly because that is where the blood vessels are. Pressing on the bony part of the nose is not going to be helpful. Apply consistent and uninterrupted pressure for 5 to 10 minutes. You may repeat for another 5 to 10 minutes if needed. If you have oxymetazoline available, you may apply 1 to 2 sprays to the nose before applying pressure. Oxymetazoline is an over-the-counter nose spray that constricts the blood vessels in the nose. It comes in different brand names. Do not use for more than 2 to 3 days though, to avoid rebound congestion. Here are red flags with regards to nosebleeds. Please see a doctor if the nosebleed started after a traumatic episode like being struck in the face. If the bleeding does not stop after 20 minutes of applying pressure to the nose. If the child becomes tired, dizzy, pale, or has trouble breathing due to possible significant blood loss. If nosebleeds occur frequently, like every week. If there are symptoms of an underlying bleeding disorder, such as bruises on the skin, tiny purplish rash called petechiae, bleeding gums, heavy menstrual flow, blood in the urine or stools, prolonged bleeding after simple procedures like circumcision or tooth extraction. How can nosebleeds be prevented? Avoid nose picking. It may take time and effort to break this habit in children, but keeping fingernails short can help prevent injuries from scratching the inside of the nose. During the dry season, use humidifiers at home. You can also apply a thin layer of petroleum jelly inside each nostril, especially at bedtime, to keep the nose moist. Use salt water or saline nose drops, gel, or spray, because it may help to keep the nose moist. Thank you very much for watching. If you found this video valuable, go ahead and give a thumbs up and subscribe.